Welcome to this MS Views and News program called the MS Forum. I want to give thanks to our two supporters for tonight's program. We have Alexion and we have Novartis, and I would hope that you all say thank you as well by giving them a round of applause. We had exhibitors, a lot of them out there. We had Alexion, A&I Pharmaceuticals, Biogen, Genentech, Novartis. We had the Multiple Sclerosis Society. We had TG Therapeutics, and I want to thank them all for being exhibitors here as well. And let's just welcome Dr. Holly Hendin to come on up.
Hi. Nice to see all of you. I always like to say I'm the other Dr. Hendin, like the disappointing Dr. Hendin. Like when I was a resident and they would say, oh, we've paged Dr. Hendin, and then I would arrive and they would say, oh, it's the other Dr. Hendin. But I'm a psychiatrist. I'm so happy to be here today. So thank you so much for allowing me to speak to you about something that is very near and dear to my heart, which is mental health and the way that MS impacts mental health and how mental health impacts MS as well. So I think that when we think about MS and mental health, I think it's pretty easy for us to think, oh yeah, well, I think obviously if somebody gets a diagnosis that is going to impact their life, maybe we could see how they might be sad for a little bit or something like that. But any neurological disease that is going on is bound to impact the neurobiology of emotions as well. And that leads to symptoms. And I think that it's important for us to think about the interplay between where the physiology of MS impacts mental health and the physiology of mental health impacts MS. So in this slide, there was a survey done in 2023 in the UK of people with MS, and just a survey in terms of how their MS has impacted their mental health and vice versa. And this one respondent, I really liked that it encapsulated so much. MS means I experience a real lack of confidence in myself in mixing with friends and going out. I feel MS has changed me from the bubbly, confident lady I was to an anxious shadow of my former self. So one person's perspective on how MS has changed them. Now, like I said, when we think about just our own thoughts on how MS is related to mental health, I think a lot of people might, a lay person or somebody, a friend of yours maybe might say like, oh, okay, well, maybe they were sad and worried about a diagnosis that was going to impact them, or other, erosion of self-esteem and or a sense of purpose in life. What I see in my practice most often is this fear of disease progression, and then especially the fear of becoming a burden to loved ones. A lot of people feel like they can't trust their body anymore. They're not sure if they go out, what's going to happen. And so then maybe they stop going out as much, or they stop trying to do as much. There are worries, of course, about finances, about insurance coverage, about will I be able to afford care if I need care? And those are real worries. And then a lot of these changes can impact people so that they lose connection to their friends, their family, loved ones, because they feel like they just can't go out. They feel like they don't want to go out sometimes, or are having an exacerbation and can't go out. The opposite is also true. MS symptoms impact mental health. So fatigue, pain, difficulty walking, changes in balance, brain fog, and cognitive changes, these are all things that overlap with depression, with other changes in mental health. So it's always a little bit difficult to know, but I would say that What I hear from my patients over and over are these core symptoms of MS that seem to really play into their mental health. And so I thought another respondent from that same survey really summed it up well. The impact isn't directly on my mental health because I'm pretty well balanced, I think, but the pain, fatigue, not being able to do stuff upsets me. And I can feel an increased reluctance to even try to do stuff that causes me pain or fatigue, or because I'm afraid of falling. And then finally, one last respondent who says, just really makes me so frustrated as I can't do the things I used to do. I really try to think positively about things, but then again, I think, what is my purpose now? So one of the interesting things about MS and mental health is that even prior to an MS diagnosis, and I would say that many of my patients have told me, like, even prior to my diagnosis, I probably had signs and symptoms that I just wasn't recognizing. So maybe this isn't such a shocker to this group here, but I think to people who aren't as familiar with MS, even prior to an MS diagnosis, I think it's in the 5 years before diagnosis with MS, people with MS were more likely to have seen a psychiatrist or other provider for psychiatric symptoms. So things were kind of percolating, and it's unclear, was there a mental health issue that kind of was a prodrome to MS, or was the prodrome of MS something similar or read as a mental health issue? Oh, I'm so tired, I must be depressed, or I'm not feeling like connecting with others, maybe I'm depressed. So this same survey from the UK in 2023 asked people, how does your MS affect your mental health? And 30% said that they felt that there was a loss or change of identity. 25% reported feeling confused, 30% frightened, suicidal thoughts, and 15% mood swings, 40% depression, 45% of people, and anxiety, 50% of all of the people that they surveyed. So MS and mental health are related, as you know. People with MS are more likely to have depression than the general population, 23% versus 10%. More likely to have anxiety, 20% versus 7%. And more likely to have cognitive impairment, 30 to 70% versus just 6% in the general population. But a question that I get a lot is, well, how do I know that I have depression? What defines depression? Is it feeling tired? Is it feeling uninterested? How can we really tease apart how much is MS and how much is depression? And it's a good question, and nothing is set in stone. Everything seems to overlap. But my kind of guiding light here is that chronic illnesses have a lot of features, a lot of similar features like cognitive changes, sleep disturbances, fatigue that we as psychiatrists might read as a possible depression. But first and foremost, depression is a mood disease. It is sadness, and it's a sense of sad mood that lasts all day, every day for at least 2 weeks in a row, and then comes with other symptoms like feelings of guilt or worthlessness, lack of interest or enjoyment, feelings of sadness, and then sometimes thoughts of suicide. So there is an overlap, but then there's also something that is distinctly different about depression. So I've spent some time kind of talking about that there is a relationship in MS, with mental health, depression, and then the question of why is it important? Well, the thing is that when people are feeling really depressed, it's not just that they don't want to go out with their friends, or maybe they just don't want to connect with others or do their favorite hobbies, but it impacts all facets of their lives. So it means that people with MS who have depression are not going to engage with the kind of treatments that might be helpful for them. A lot of people who have depression in the context of MS are not going to be taking their medications as often, or they might be canceling appointments with their doctors. Maybe they're not engaging with physical therapy or eating a healthy diet. And so it's just very important to consider mental health as a facet of the MS that deserves equal attention. And then we'll kind of come back to this point at the end of my talk. So we've talked about a little bit about depression, about why it's important to think about treating depression and MS. So what are the treatments that are available? Well, they're the same standard treatments that are available for anybody with depression or mental health issues. So depression, anxiety, and mood changes, there are medications that we use in psychiatry. They can also be prescribed by anybody, including neurologists and primary care physicians and family medicine. So we don't have we're not proprietary about treatment. We want everyone to be able to seek treatment. And a lot of times the first line in MS really is the neurologist. So neurologists can prescribe these as well. So SSRIs, they are selective serotonin reuptake inhibitors, trying to modulate the serotonin to create some downstream effects that help with mood and anxiety. If you have been diagnosed with a bipolar disorder, then SSRIs are unfortunately out, but that does not mean that there aren't treatments for you. So fluoxetine is the brand name of Prozac, sertraline is Zoloft, escitalopram is Lexapro, and that's just a little small handful of the SSRIs out there. SNRIs are the serotonin and norepinephrine reuptake inhibitors, venlafaxine, duloxetine, and desvenlafaxine. Duloxetine is Cymbalta. It has the added benefit of being able to help with neuropathic pain as well as depression and anxiety. So that's kind of a nice one to tuck away. Bupropion is Wellbutrin. So of all of the antidepressants that I prescribe is probably the most activating. A lot of people say, my mood is okay, but I'm just feeling like really low energy and not interested. And bupropion is a pretty good choice for that. And mirtazapine is an interesting one. It helps people who are struggling with sleep or lack of appetite, so also antidepressants. Mood stabilizers we usually think of for people who have been diagnosed with bipolar disorder, so people who have depressions, and then instead of just kind of coming to a baseline, have these kind of manic or hypomanic periods, and then come back down to depressions. And lamotrigine is probably my favorite medication of all time. If I could only take one medication to a desert island full of people who needed treatment, it would probably be lamotrigine. It just helps people feel, usually people say like, it helps me feel like myself. And that's a wonderful thing to say about medication. I do not get anything from lamotrigine makers. I just like it. Lithium is another great choice. I went to a conference recently and one of the presenters said that lithium is the only antidepressant that has evidence to support that it creates benefits long term. And so he advocated for everyone being on lithium. I am not of that opinion, but I do like lithium. It can be useful. Depakote is another anti-seizure medication that can help with mood. And then there are the strangely named atypical antipsychotic medications. When I prescribe these, sometimes people will come back and say like, oh my gosh, I looked it up and do you think that I'm psychotic? And I'll say, oh no, these are actually, so many of them are not that effective for psychosis as far as I have seen, but they are really good for depression as an augmentation with depression. So aripiprazole is Abilify, quetiapine is Seroquel, and then brexpiprazole is Rexulti. And then I didn't put it first because I'm not a psychologist, but probably even before we think about medications, if somebody comes to a provider and says, I've been feeling pretty depressed and down, what do you think I should do? I would say the majority of people will say, have you thought about talking with a therapist? And then what I hear back from my patients is, I don't even know what to look for in a therapist. I don't know what kind of therapy they do. Is there something I should be telling them or looking for? And so what I usually say in terms of the psychotherapy component is that what really matters the most in your therapist is that you like them and you trust them and the relationship that you build with them. And of course that they've been trained and, are supervised by a board. But beyond that if they are a social worker, if they're a licensed counselor, if they are a psychologist, a PsyD, that does not matter as much to me as what matters in terms of people feeling comfortable. If you can't feel comfortable, if you don't trust your therapist, then all bets are off. You're not going to show up, you're not going to be vulnerable, and you're there for yourself. And then any of the therapies really, I think, are beneficial. Cognitive behavioral therapy is the gold standard, honestly. Acceptance and commitment therapy is a really wonderful type of therapy for chronic disease because it's this kind of radical acceptance of where you are right now and then a commitment to living your life fully, regardless of the limitations. So, and then practicing the skills around that. Somatic experiencing, EMDR, IFS are really wonderful trauma therapies. Dialectical behavioral therapy is also a wonderful skill building type of therapy that I think is great. Mindfulness-based cognitive behavioral therapy at one point was probably right up there with lamotrigine for me. I just loved it, and I still do. I think it can be really wonderful, maybe more well-known for mindfulness-based stress reduction. And there are groups that you go to where you learn these skills about mindfulness, which is a breathing meditation, and then how to use mindfulness to reduce stress. And it really works. They say the goal should not be to de-stress, and yet you do de-stress. And then even just supportive therapy, which is really you go in and you tell your therapist, like, wow, I've just had this terrible week. Can I tell you about it? And they say yes. And then you proceed to tell them what a terrible week. And at the end, they're like, well, what can I do? How can I help you? How can I support you better? And even that's an effective form of therapy. So keep all of that in mind. Now, if you have tried lots of different medications, but you are still feeling depressed, there are other types of treatments out there, even beyond the medications and even beyond different styles of therapy. And ketamine treatment is a very effective, very fast antidepressant. It wasn't developed as an antidepressant. It was developed to be an anesthetic, but at sub-anesthetic doses, it can create an antidepressant effect very, very quickly, like right as it's infusing in you or within the next few minutes or hours. But unfortunately, it doesn't last very long and it kind of goes away quickly thereafter. You can have multiple treatments in a row, and then sometimes that helps the effects last longer. And then S-ketamine is the brand name Spravato treatment for depression. That one is covered by insurance, so makes more sense to many people, because otherwise ketamine is quite expensive. So S-ketamine is also effective. It also works quickly, but because it's covered by insurance, you can get like 2 treatments a week until you're feeling better, which is nice. And then in terms of like potential for MS-related fatigue benefits, that's a study that's ongoing. I think they just ended their selection of patients. Another type of therapy that's out there that I don't think a lot of people know about for depression is called transcranial magnetic stimulation therapy. Really, really wonderful therapy. It is not like One Flew Over the Cuckoo's Nest, I promise. You are not sedated. You can go in 20 minutes later, you walk out. The very standard way of having a TMS treatment is that you have one treatment 5 days a week for 6 weeks. But after that, it does affect, it's really trying to regulate the glutamate and the GABA. And after the 6 weeks are over, I would say even by week 3, there's improvements. And what I like best about TMS for consideration with depression in somebody who is also diagnosed with MS is that the benefits are less fatigue, better cognitive clarity, and then mood. So there have been studies that have shown that people with MS seem to benefit above and beyond other people with depression who don't have MS in terms of improvements in cognition, mood, and energy. And then on the horizon, maybe, is psychedelic assisted therapy. It's not just going into a field and taking a bunch of mushrooms. If that were true, then everybody who went to, Burning Man would be like cured of their depression forever and ever. So it's using psychedelic medicine in the context of therapy. And I would say even, I didn't mention with the ketamine, but even with ketamine treatment, so ketamine is not a psychedelic, but it can create kind of psychedelic experiences. And to prolong the benefits of ketamine, usually people will say if you use the therapy with it, that can help prolong the antidepressant activity. And then psychedelic assisted therapy is using these psychedelic medicines to really process through a lot of things that are hard to talk about. Above and beyond that, it's possible that psychedelics can have some potential for treating autoimmune disorders. And there is a medication or a psychedelic medicine called Ibogaine. And that has you maybe saw this in the news, I don't know, it was recent, that it might be able to reduce MS lesions or promote neuroplasticity. Now, psychedelics are not legal yet in the United States, except for in the relationship with a medical study. And I don't think a lot of studies are happening in Phoenix, but maybe California would be a place to look, not too far away. And then psychedelic assisted therapy is legal in Colorado and in Oregon. So keep that in mind. Now, it wouldn't be a talk like this without talking about wellness, but I don't want it to be cliche. I actually am a very big believer in wellness practices. And I would say, like, over and over again, this is what I bring up when I'm talking to my patients is, yeah, the medications, yes, all the stress going on in people's lives, but like, can you commit to wellness? And it's hard. It's hard to establish routines that maybe don't feel as good in the moment. So you're feeling tired and somebody says, oh, you should exercise. You'll feel so much better. And you're like, no, I'm tired. But there is a place in the back of your mind that maybe agrees. And so I would say, open up the possibility that wellness practices could be something to help, and you don't have to do them all at once. You could pick one and start to make the change there. So is it sleep hygiene? Would it be just taking your phone out of your room at night? So they did this study where they were measuring people's ability to focus and concentrate, and just having the phone out of sight, people were able to concentrate better. Even if the phone wasn't going off or anything, we've become I have my phone right here, for goodness sakes. Like, we've become so attached. I think I read somewhere that it said, if somebody said they want you to put your phone in another room to go to sleep and you're anxious about that, then maybe you need to explore your relationship with your phone a little bit more, because we shouldn't be so dependent on something like that. walking if possible, healthy diet. All of these things reduce inflammation, cortisol. Like, these are tried and true. Your grandma was right. If you went outside and took a walk, you probably feel better kind of things. Some more wellness practices that can improve well-being. Gratitude. I always say it's hard to be angry with somebody if you're like working to be compassionate or grateful for them. So it's something to consider. Being in nature. It's hard in Phoenix to find green spaces, but especially they say green or blue spaces. So the ocean or water or something like that. Could even be a pool. Or a park or something like that, like lowers stress levels and helps people feel more relaxed. Reducing screen time. Building community. All of you here tonight, this is a little community that you have built and you didn't even realize it's temporary, but you could make it permanent just by saying hello to the people around you and getting contact information. Other resources, grounding techniques. My favorite one, my very favorite grounding technique, I went to a talk from this very famous mindfulness practitioner, and he said, everybody close your eyes and just think about this question: where are my feet? And that is like a grounding technique that you can just use anytime to kind of drop in. The other one that I really like is relying on your senses. 5 things I can see, 4 things I can hear, what can I smell or taste or touch. So I think connecting to your sense of purpose and passion is something that really starts to potentially get eroded with any disease, with depression, with MS, with stress, being an adult. And I think the more that you lose track of it, the more it gets lost track of. And so really having this like kind of, where is my North Star? What is my North Star? And then rearranging and reprioritizing your life to reflect that. Here are some people will say like, I can't, afford a therapist, or I don't have time, or I don't want to do that. Is there anything else I could do? Apps. Okay. Apps and podcasts are a great kind of maybe entryway into therapy. You can learn the lingo a little bit. Headspace is great for mindfulness. Calm, a really wonderful, I just told you guys to get all your phones out of your room, and now I'm like, why don't you use Calm and Headspace and look at these apps and podcasts? So, everything in moderation. But getting your phone out of your bedroom at night is something to think about. These podcasts are great as well. So in the beginning, I had said, it's really important to know that so many people with MS really feel a lot of these symptoms: depression, thoughts of suicide, fatigue, lack of purpose. And then this is the statistic that always sticks with me, that in that survey in 2023, of the 2,000 people that they surveyed, who, by the way, were all the people with the 50% of the mood swings and all of that, only 9% had ever told their MS team that they were struggling with this. So first and foremost, there's help available, but you need to kind of find within yourself that strength and bravery, really, to be able to say this to your providers. And if you feel like maybe your doctor's rushing in and out and doesn't have time, then tell the nurse or tell the medical assistant. And you could also just make an appointment with a psychiatrist. You usually don't need to be referred. So keep that in mind. Yeah. You're not alone, so ask for help, because we're here to help, but we can only help you if you come to us. So that's kind of the main point of what I have to say. And then Mary Oliver, one of my very favorite poets, and I love this one. This is from The Summer Day, and she says, "Tell me, what is it you plan to do with your one wild and precious life? So the more that we remind ourselves of that, it's not just about, the kids were fussing and I had a stressful day and I feel bad about myself and the dinner burned or whatever. It's like, and this is your life. This is your one wild and precious life. So what are you going to do with it? That's my talk.
Let's thank the doctor. Does anybody have questions? Great.
What can you tell us about the goodness or the ineffectiveness that for lion's mane for MS patients?
Yeah, I know a lot less about those kinds of mushrooms than I know about the psychedelic variety. But what I usually tell my patients is if it's not harmful and it's potentially helpful, then I don't have a problem with it. We have this very interesting thing as humans, which is if we believe something is going to be effective, then it's more likely to be effective. I think that's one of the reasons why it's so important to like and trust your therapist, because if you believe like what she's telling you or he's telling you is effective, then it's more likely to be that way. So I don't know the literature on it. Do you know the literature on it? No. I love mushrooms, and not just because they're tasty to eat in, pasta, but I think mushrooms have a really wonderful kind of role in our lives and underappreciated. They actually can do so much with our environment. They can break down like plastics and things like that. It's kind of amazing. So, yeah, something for me to look up. It's a great question.
There is a local mushroom grower here in the Phoenix area that you can, I think, either get mushrooms from him or get mushroom starts.
Yeah, like lion's mane and those kinds of mushrooms.
Right.
Yeah. Yeah, you can get little kits to grow, not the psychedelic kind because that's not legal, but all the other varieties. And it's fun to watch mushrooms grow. If you've never done it, I highly encourage because it's just kind of amazing.
Mushrooms around here very dry. I'm joking. It's dry climate. All right. Are there any places that you could recommend that people can get resources from on mental wellness?
Yeah. Like which kind of resources are we talking about? NAMI is a great one. It's one that I think about as the National Alliance for Mental Health. It's a great wealth of resources and trying to think of others. In terms of looking for a good therapist, I usually tell my patients to look at Psychology Today. It's a database and you can filter it for what you want. So the wonderful thing is you could say, I only want to see a woman therapist and I want her to be in Scottsdale and I want her to take United Healthcare or whatever. And I want her to have specialty in chronic illness, for example, or in acceptance and commitment therapy.
Can you say the name of that one again and maybe the website?
Yeah, it's Psychology Today. So I think it's psychologytoday.com. I think it's a magazine. So in real life, it's that magazine that you can find anywhere. But online, they have this really wonderful wealth of not just the database of providers, but lots and lots of articles about health and wellness and maybe mushrooms. We could look there and see what they have to say there. So yeah.
So if you were going to access that online, like if I were going to do it right now, how would I do that?
How would you?
How would how would I type it in?
Oh, for Psychology Today?
Or like finding like if I like want a therapist who's a woman who's very
Yeah,
kind,
yeah,
who's
yeah.
very smart.
So honestly, if you type into your search engine of choice, I tend to use Google just because it's there, and you just say therapists in Phoenix, Arizona, one of the first 10 sites that comes up is Psychology Today for that database, but it's already been filtered because you said Phoenix. If you didn't want Phoenix and you wanted Scottsdale, put Scottsdale in or wherever. And then from there, if you click on it, it'll give you all the therapists in Phoenix. And then there's a little filter button, and then that's where you start to select what insurance. I want them to do CBT or DBT or ACT or those things. Yeah.
Got it.
Hi, I'm an interior designer and I specialize in healing environments and very much now am very focused on the neuroscience of interior design. And I think the time is right for people to be more receptive about that. And I was wondering how you felt about the environment and the influence of how the environment can either hurt or heal you
Yeah.
with MS.
Yeah, definitely. Well, the environment in terms of like the inner, like a room, or environment like outside the earth, or all of the above.
Repeat that question.
That the tagline of her book is "Rooms have no feelings, you do." Yeah. So one thing to note that when you started talking about that is that with psychedelic assisted therapy, what really, really makes a big difference in the way that your experience is going to go is set and setting. And part of that is, what kind of room are you in? Or are you in nature? Or do you have art around you? And it's not as simple as it needs to be green space, or it needs to be the color blue, or it has to be art, because everybody's so different. I know plenty of people who don't care about art at all, but they are so interested in music, for example, another thing that really, really influences psychedelic therapy. And so, and then you really like try to build for them this amazing playlist. So yes, I think it's almost, what we don't know about humans is so vast to me, like the placebo effect, which I actually really love, because it's like how much strength and wisdom is within us that sometimes we can tap into, although we don't know exactly how. But same with like all these influences that we're just not aware of. And I would say, like what we are seeing around us day to day definitely influences us. Green, like I was saying before, green spaces, blue spaces in nature, and the benefits of those. So yeah, I think that's really wonderful. Yeah.
Thank you. Why would a person see a psychiatrist over a psychologist, or vice versa?
Yeah, that's a great question. So, psychiatrists, I would say, if you are interested in medication management, unfortunately, with managed care, therapy and medication management kind of got split, and the therapist took the therapy and the psychiatrist took the medication management. So, if you feel like your medications are really well managed by, for example, neurology or your primary care, then, but you're still feeling like you're not quite getting enough therapy or sense of purpose, or that would be a good reason to see a therapist. Also, I would say anxiety. Anxiety works really well for therapy because there is no medication that will just take away anxiety. And I wouldn't want one to be out there, honestly. I think it would be kind of scary to move through life without any warning system. But learning to manage your anxiety is really kind of the big part of anxiety treatment. So, yeah, a lot of it is, are you thinking about medications or are you thinking about therapy?
Thank you.
I think it's used more for pain management, but where do you stand on like CBD products as related to depression and MS and things like that?
Yeah. I think, CBD is I know less about it, but I have read that it can be very, very effective for pain management and even relaxation before bed. It's the THC component gets a little tricky. It can help definitely with spasticity and MS symptoms like that. So it's not that THC doesn't have a place in MS treatments, but sometimes in psychiatry, I end up seeing the like THC gone wrong. So the paranoia and racing thoughts. And I just saw at that conference that I went to, where the man who loved lithium so much, he thought everybody should be on it. There was another talk that I went to about cannabis and what they were saying, which is if you're using THC product on a regular basis, then it's possible that like you take it at night and by the afternoon, next day you're having a withdrawal from it. And that withdrawal looks a lot like depression, anxiety, like spaciness, amotivation. And then you're like, oh my gosh, I'm feeling so depressed and anxious. Maybe I need to use more cannabis. And so that's where it gets a little tricky. But CBD, I think, is something, it's usually where I try to negotiate with my patients if they're using a lot of THC. I'll be like, but CBD is also really effective and it doesn't carry with it the other negatives of THC. So yeah, as with the mushrooms previously, like if it's helpful and it's not harmful, then I think go for it.
Let's thank Dr. Hendin for being here. Thank you very much. Thank you and have a great night.